Hi, everybody. So, we're going to talk about drug abuse and addiction today. I'm just going to give you a short lecture because there's actually quite a bit of supplemental stuff I want you to read, watch, and listen to after lecture. And plus, I feel like this is one of the topics in social problems where it's best if you see how it's playing out in the real world as opposed to me just lecturing to you about concepts and theories. I'll give you a few of those to guide you. But I kind of just want you to hear about drug abuse and addiction um, and how it's being handled by people in the field. So, with that in mind, what is drug abuse? So, the term drug abuse is very broad. So, drug abuse is the abuse of any drug or medication. Like, we're talking drugs, alcohol, all of it sort of gets packed into one system. So any abuse of a medication, any abuse for medication for a reason other than it's attended, anything other than clinically significant. And addiction is when you have some sort of psychological or physical dependence on a drug or a medication. So alcohol abuse and drug abuse tend to be used interchangeably. Alcohol abuse is obviously abusing alcohol, drugs is obviously abusing drugs, but basically they're getting at the same thing, that you're using it for anything other than its intended purpose. So for alcohol, the purpose is to have a drink with dinner or be drinking casually with friends. The purpose of it is not to get blacked out or to be so impaired that you can't function, or et cetera, et cetera. You get what I'm saying? So here's how sociologists look at drug abuse, look at addiction, look at alcohol abuse and dependency. So if we're thinking about it biologically or psychologically, we're looking at how alcohol and drug abuse is inherited by people. That's one of the major ways that both of those areas look at dependency, which is another way of saying drug and alcohol abuse. It's who in the family had it, how did the family teach you about it, all of that stuff. But what these don't explain are the social or the structural determinants of addiction or drug abuse. So structural functionalist theory says that society is going to give us norms or guidelines on alcohol and drug abuse. And I laugh because basically what they're saying is, hey, as a society, you have figured out what is the acceptable way to ingest this drug or to take this drink. And that is up to the society to determine. When, the way that US society views alcohol, for example, is very different than the way it's viewed around the world, right? Other countries see no problem with kids having a sip of wine with dinner, and there's no drinking age, or, the drinking age is a lot younger than it is here, 16 or 18 or something like that. The functionalist perspective also says that they're going to give us that as a society, we determine the norms for drugs and what is acceptable with drugs. So this has changed a little bit now that we see rises of things like legalized marijuana and CBD oil and all sorts of things that were previously considered drugs or narcotics or whatever. We see that changing a little bit, but functionalist theory is going to say to always look for the society for the guidance on what is acceptable with that. They also use, when we're talking about substance abuse, they use Durkheim's theory of anomie, which we've talked about previously. But basically, anomie means a lack of normlessness, right? So it means that you've entered a place where norms no longer apply to you. So without norms, people are going to, according to anomie and according to Durkheim, people are going to engage in self-destructive behavior like in alcohol abuse, like drinking until you've blacked out, or doing drugs until you can't function anymore. And that part of this is from what we call role strain, which basically means that people don't have the ability to handle whatever situation they're in, especially if it's demanding. They find role strain, right? Like that's where the strain comes from. And so they're going to feel this anomie or this lack of normlessness, lack of norms. Conflict theory. So conflict theory says that it's been kind of random in the way that we decide which drugs are illegal and which drugs are legal, and that powerful people are going to manipulate the way that drugs are seen, or images of drugs are seen and their users, For example, you saw this in 13th, the film we watched when we talked about race. And you saw people talk about the difference between crack cocaine and rock cocaine and powder cocaine, and how each was based in a different class of society. And if you were in lower class, you were considered, that meant you had to do crack cocaine, which also brought a longer prison sentence with it if you were caught, versus powder cocaine, which is considered more wealthy and proper and, whatever. And you would have less prison time or less repercussions for being caught doing it. Conflict theory would say, yeah, this is part of the way that we keep people in power. And this is also part of the way that we manipulate which drugs are acceptable and which drugs aren't acceptable, and what happens to people when they are caught using them, or when they use them to the point where they impair themselves and commit some sort of other crime. Feminist perspective. A couple things with feminist perspective. One of the things that's happened throughout health history of health, and we'll talk about this more in a few weeks when we talk about health, is historically women, particularly women of color, and really specifically Black women, have not been treated very fairly in the healthcare process, meaning that when science studies what is wrong with people, so if you are sick and you have something and you are studied because of it, a lot of science for a long time felt that men and women were interchangeable, so that the things that happened to men were the same. Women were reacting the same way. That women's health didn't need its own sort of category. It could just be interchanged with men. And we're finding that that's obviously more and more not true. And hopefully for a lot of you, that sounds just completely bananas, that we would say men and women are interchangeable. Clearly, they're not. And clearly experiences for people of color are going to be different. Even if we just look at like rates of women of color going to the doctor are extremely low. Feminist perspective is going to say that with addiction, experiences are unique to women, gay and lesbian populations, any marginalized group. How addiction affected them has been relatively ignored. Similarly with health, physical health, we've assumed that addiction and mental health are interchangeable with men and women, and that's just not true. Also, what hasn't been taken into account when we talk about addiction is things like pregnancy, if a woman is pregnant and addicted, childcare, if she needs to have childcare to go into drug treatment, or if she's pregnant and going into drug treatment. These are the things that feminists are saying need to have more attention paid to them. Symbolic interactionists are going to say that drug abuse is something that is learned from others. So what this is saying is that people find meaning in seeing other folks doing drugs and that sort of like object lesson. It's also symbolic interaction is also interested in the label abuser, and how a society responds to a person once you've been labeled a drug abuser, alcohol abuser, how people treat you once you have that label applied to you. Okay, so that's just the basic theoretical stuff. What I want you to do, give me a second. So what I want you to do is, when you're in the week 8 module, you're going to see the lecture I just did, and then you're going to see 3 videos. So I want you to watch all 3. The Last Week Tonight episode is going to talk you through the opioid crisis in the US. And then what I want you to do is look at this video about how Portugal legalized drugs. So in Portugal, they legalized drugs, and this clip is from Canadian television. It gives you kind of an idea of what happens when a country says, we're just going to legalize drugs and take it from there. I think you might be surprised at the outcome. And then there's also a podcast I want you to listen to, from a podcast called Pod Save America. They did a special on how countries have legalized drugs, and basically these rooms that they've created where if you're going to do drugs in a country, do it in this room where you are observed by medical staff and you can receive help if you need it. And it's a very interesting concept of having people get high or shoot up, or whatever word you want to use, in a sort of controlled medical setting where if they overdose, there's somebody there to save them. So, reducing the amount of drug-related death. So that's what I'd like you to do next. And thanks. See you next time.